Meanwhile, the World Health Organization has declared monkeypox outbreak to be a global health emergency, the highest alarm that it can sound. The WHO chief has confirmed that the committee had in fact failed to reach any kind of a consensus, with 9 members against 6 in favor of the declaration. His decision is likely to back the highest alert level due to concerns about the escalating cases and also a short supply of vaccines and treatments, despite the lack of a majority opinion.
So in short, we have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little and which meets the criteria in the international health regulations. For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
A public health emergency of international concern is designed to sound an alarm that a coordinated international response is needed. And this could, of course, unlock funding and global efforts to collaborate on sharing vaccines and treatments. So far this year, there have been more than 16,000 cases of monkeypox in more than 70 countries and 5 deaths in Africa. The viral disease, which spreads via close contact and also tends to cause flu-like symptoms and pus-filled skin lesions, has been spreading chiefly amongst men who have sex with other men in the recent outbreak outside of Africa, where it is endemic. Remember, the reason why this has captured global headlines is effectively because this disease, monkeypox, which is said to be endemic in certain parts of Africa, had been spreading in places such as Europe and North America, which is what prompted a lot of these headlines that we've been witnessing in the last couple of months. Now, the WHO and the national governments have been facing intense pressure from scientists and public health experts to take more action on monkeypox. Cases on the viral disease have ballooned since the committee first met at the end of June, when there were just about 3,000 cases. At the time, the expert group had agreed to reconsider its position on the emergency declaration if the outbreak escalated from there.
We know that from the countries that are reporting cases at the moment, roughly half of them have already secured access to this vaccine. For those other half, we don't know for the moment. We have some information that some of them are in discussion with the manufacturers to procure this vaccine.
When this vaccine is given in a pre-exposure context, it is not like giving an antiviral. It takes time for vaccines to work, and in this case, it can take up to 3 weeks, I believe, for this vaccine to take full effect. So being vaccinated does not give you instant protection. The best way to avoid this infection is to avoid being exposed to it, and if you are exposed to it, to avoid being the person that transmits that further to somebody else.
And also, it's in fact noteworthy that the World Health Organization has only triggered a global health emergency only twice earlier. Once it was for the coronavirus pandemic and the ongoing efforts to eradicate polio. WION is now available in your country. Download the app now and get all the news on the move.